Hi, let me show you our patient and client orchestrator. The thing is that when a patient or a client is with the provider or service, of course that provider or service knows where the patient is, who's responsible and so forth. But what happens when you send a patient or refer a patient and then transfer a patient to a different provider? Who's in control? Who's seeing what? Who's responsible when the patient is just sitting there waiting for an appointment? And do the doctor who referred it get the appropriate confirmation that things is actually happening with his patient? For that, we have created this system. I'm going to log on as Phil, and the example we're using here is just an example. The nice flag up here is for the Bahamas, and we've got medical entities here, lists of hospitals, physician practices, rehabilitation facilities. We got other entities also, because sometimes healthcare is linked to social services, retirement, law enforcement, and it goes both ways actually. But this is just an example. Okay, so Phil is working on a case for Mark Rash, but he's a bit unsure what to do about it, so he needs a different expert. And for that, he can discharge or transfer to another healthcare provider. By the way, he can also do more. He can create a new case for another healthcare provider, or for law enforcement or social services for that matter in this example. But in order to select who is going to transfer Mark to, he has to do some research. So he looks at medical entities, and he needs somebody who could do rashes. And we have narrowed it down here, and he definitely needs a hospital, he thinks. And as Doctors Hospital is in Nassau, where he is now, that would be the natural choice. But it would be interesting to see what the wait time is currently. And if he clicks on the green one, which is for health, it expands. We only have two in this case here, or this example. We got Doctors Hospital with 5 days average waiting time, and the rehab center with 7 days. And of course we have that historically also, because that smoothened things out. So now he has decided, and he's going to discharge or transfer actually, which is his choice. And here he gets up some fields, which is partly for the case and partly for the actual transfer. The first part is for the case. And these fields can be totally up to the services that would be using this. And we can also add files here, say an export from your EMR system or similar. And that follows the transfer and not the case as such. So for later, there will be new transfer with new transfer files and so forth. So let's put in something here. And that done, I have to select what entity type, hospital, and there I get the list. I'll choose a Doctor's Hospital, and then it knows who's on duty, which is what I want. I don't want to send to info at something. I want to send to a real person that now takes responsibility. And now my case is not more current. Mark has been discharged, and it's now under request, and I can see that the transfer files and information, and I can also see who has the handover request currently. So I'm going to log out and log on as Marion. And she has a prompt here with the details, and has to choose if she can do it or not. If not, she has to select somebody else and do the same round again, without adding any transfer notes actually. I'm going to set the schedule, and I'm going to do it in 1 week at noon, and it's going to be a visit. And that's that. So now Marion has a current booking at Doctor's Hospital. She has two actually, and this was the one. And from that one she can reschedule, and if she does, the patient will get a notification, obviously with an email notification at the side, a prompt, or even an SMS if that's wanted. And when the patient walks in the door, she can sign in from this point and then select the responsible and so forth, and then it moves on to the next doctor or therapist or whatever it is, or case handler, which then can discharge finally or transfer to another one. And so it goes. And in the meantime, this case will capture every transfer, so you will have a full overview of all transfers in chronological order and see where the patient has been moving or the case has been moving all the time. And now I'm going to log in as Mark, the patient, because of course Phil, the doctor, now got a message, just like Mark got, that somebody has taken over his patient at Doctor's Hospital, and now Mark get this, that he is scheduled with the details. It's just a notification, but he has his bookings here. I can see at any time when and where and so forth, and he can also request a reschedule from this point. And the case here would normally have then the transfers to show for. And my cases, he's got a current case, he could have concluded cases, and he could have request, because up here he can set up and ask for, create a new case and request, i.e. request a booking for healthcare providers, social services, or even law enforcement in this example. The system also captures who touched upon the patient at all times, and it shows what in regards what case it was. So this list will just expand over time. And finally, he can also edit himself, but he can also update his different backgrounds, this case health background, or allergies and immunization, to keep it all up to date. I think that was all. Thank you. Bye.